So going first here on the last day of the conference, glad to see you all here this morning. It must not have been out too late last night, so that's not bad. Little background on me. I'm an epidemiologist by day, DGen by night. Some of you might also have your daytime and then your nighttime professions. For me, I've had a very storied background. Worked within academia for a long time, specifically working in and around population health statistics and trying to get resources out in front of disease. And then transitioned very quickly over into med device. So working with new technologies, developing technologies, spent a decade with Intuitive Surgical. So if you're familiar with the robots that are on Grey's Anatomy and other things. And then now I work with new and burgeoning technologies and companies who are trying to find their clinical beachhead. And for me personally, I think innovation is born ugly. This is one of the first circuits back in the 50s, Texas Instruments. Doesn't look great. It looks a hell of a lot better today, right? But clearly, this isn't something that a lot of people wouldn't necessarily hang their hat on and say, hey, I was part of that, right? Next part is something that's near and dear to me. In 1996, this was the surgeon console for Intuitive Surgical. Looks something like out of the Terminator, but the surgeon would sit at that console. Their hands go in these little finger traps, and then they recreate a three-dimensional view of the inside of the patient's body, and that's from the point at which you operate. And then in our space, innovation being born ugly, some of you may or may not know Kevin, but this is a little bit symbolic for me in that, innovation's born ugly. We're still early, right? Like this whole Kevin thing was, for those of you who either invested in Pixelmon or know the story about it, I think that's kind of where we are in terms of our timeline within healthcare. So if you're in healthcare, and you've been around for the last 20 or 30 years, you've likely read this book several times. It's a reference point for a lot of the things that we've done and we continue to do from a computational perspective. So before, healthcare was this, very respected, and still is in many ways, but a very respected, and people trusted the data and trusted the delivery without really asking any questions. And what To Err Is Human really proved out to us is that we still have a long way to go, right? People still make mistakes, and we are human, and that's okay. So then how do we move forward with that? We have to create processes around it, right? And these process flows are independent for each facility, and we're trying to basically go through and process and proceduralize human behavior, and that can be incredibly challenging, right? If you've ever gone through the task and sat down and you go through and you say, okay, how do you make a peanut butter and jelly sandwich? And you write down all the steps, it's incredibly laborious. Now take that same process and do a mitral valve repair. You're going to be writing for a very long amount of time. And all those steps that go into it, it's just very challenging. Above and beyond that, you have a giant elephant in the room, and that is just government, right? So if you look at breaking into the gaming industry, the one word that you could push back on is, Microsoft is doing that. The one thing that I think we're going to have a really hard time pushing through is just the HIPAA. Right? HIPAA alone, let alone all the different regulations and stipulations that go in and around approving different things, whether it be drugs, device, et cetera, within the healthcare space. So infrastructure. It's this interesting, when we talk about beast or burden, the infrastructure side of things, is it carrot? Is it stick? What's the best way to motivate healthcare providers? What's the best way to motivate the hospitalists, or even just like the local folks that are approving this process or that process? And you can see just on the EMR side alone, right, and electronic health records, it took about 20 years just to get to the point where we are now, and still about 95% adoption in EHR, right? There's still a large amount of folks in the United States who don't have access to EHR, especially within behavioral health. So that's, just an interesting perspective given that EHR has been around since the 60s, and here we are more than half a century later, half a century later, we still haven't figured that out. But this is the point that I think is really important, and it's, Rome wasn't built in a day, but they worked at it every day. So how do we take off like little meaningful, bites to do a couple of different things? Number one, we have to be able to solve something. Having a technology in search of a solution or in search of a fit is not as good as having a clear and obvious solution to a problem that is reasonable. I think the other, confine that you have to put out there is that just because you can do it doesn't mean you should. If there's a current process that is able to be used, with the current technology that's available, great. If there's something that we need to solve for, or something that could be solved for more effectively as NFTs or blockchain, et cetera, continue to evolve, then sure, let's evaluate that. But it's going to take people, obviously the folks here in this room, and then those who are at home doing this as well, given the opportunity to continue to explore and work with this. So use case complexity, this is just a couple of examples. Number one, counterfeit drugs. Is there an opportunity to use blockchain to effectively track these things over time? Another example is that's near and dear to me is within MRI and CT. So these are incredibly complex images, right? They hold a bunch of data, right? But at the same time, is there an opportunity to use a trustless system in order to not only get the read locally, but could you, incentivize CMEs or other things and put that out to, a cloud environment, and then that's some sort of incentivized real-time improvement within the CT or imaging space. And then the pied la resistance, right, is just this health passport. But that health passport comes with a lot of different problems as well. Who's going to fund it? Who's motivated to actually solve that problem? And who's the custodian of it, right? Ultimately, I'm a believer that it should be the individual, but we've got a long way to go. An example here locally, and something that's happening right now, is with 23andMe and Ancestry.com. These are different use cases, but you give them your information, right? And then they sell that information in order to provide different data for drug development, et cetera, et cetera. Genomes down, there's several others that are popping up, give the user the ability to basically monetize their own genome, right, and their own DNA. So this is a really interesting example, and I'm very interested to see how this is going to continue to play out just as a real life example. And then ultimately, when we come back to it, who's going to be the center of all this? Right now in healthcare, you go to your doctor and you have that trust in that physician to say, hey, take care of me, help me out. There's something that I don't know what's going on, and I need your assistance to do it. The issue that we have with that is that if you've ever actually tried to navigate the healthcare system for yourself, a loved one, or anyone else, going from step to step to step, it's incredibly cumbersome, right? And not all folks are incentivized to actually educate you on what's going on, why, how to pay for it, or any other things, the myriad of questions that ultimately come up when you're seeking out care for yourself or for a loved one. So how do we transition from, hey, it would be really nice to use blockchain and NFTs and other things within healthcare, but how do we get over these educational and other barriers in order to really incentivize and motivate that individual to say, hey, this is something that I'm really interested in. I want to be at the center and the custodian of my own care. Do I really care enough? And do I have the resources with which to actually be the leader and the driver of my healthcare? And I think that's another area where the verdict is still out in a lot of different areas. So we went through a couple of different examples here today. I think there's going to be a myriad of things from now until next year that we'll see, different use cases coming out. But I really think that we need to really define, is this a technology that is in search of an application, or are we able to actually develop these small beachfronts that we can then develop real use cases? Because that's ultimately going to drive the pathway for regulation and adoption. So just keeping that in mind, what are we doing? Is it what we should be doing, and does it ultimately benefit the patient? That's centric for all of this. So any questions, I'm happy to take them, but I think we'll probably just roll on to the next folks. So I really appreciate you being out here this morning, very early on a Thursday, and I'll see you all around. All right, thank you.